Good morning, dear students. Good afternoon already. We continue to tell about vitamins, and today we will tell about fat-soluble vitamins already. That's why you see it's a second part of our lecture, and fat-soluble vitamins A, D, E, and K. Let's repeat, please, that all fat-soluble vitamins, they are hydrophobic compounds. That's why they have some special properties, differs from water-soluble. First of all, they must be transported in the blood, and they have been absorbed before this in the intestinal together with lipids, and their absorption and transportation depend from the normal digestion and transport of lipids, fats first of all. And all disorders of lipid digestion, like liver problems, disorders of this liver biliary system, or pancreatic problems can lead to deficiency of these vitamins. If we tell about transportation of these vitamins in the blood, they are transported in lipoproteins, or they attach to specific binding proteins after absorption. These vitamins can store in different organs, mainly in the liver and in adipose tissue, and hypervitaminosis may result. And single large doses may prevent deficiency. We start from vitamin A, or anti-xerophthalmic vitamin. See on this scheme, the active form of this vitamin is present only in animal tissue, and all the compounds with vitamin A activity are referred to its retinoids. And retinoids, see, it's a polyisoprenoid compounds containing cyclohexynyl ring. Three different compounds with vitamin A activity are retinol, retinal, vitamin A aldehyde, and retinoic acids, with corresponding functional groups on the polyisoprenoid side chain. If here alcohol group, we tell about retinol. If aldehyde group, we tell about retinol. If you see here carboxylic group, we tell about vitamin A acid, retinoic acid. Pay attention that all the double bonds in the polyene chain have a trans configuration. Hence, the natural occurring vitamin A is all trans vitamin A. The provitamin carotene, it's a carotene family, really. Maybe alpha, beta, gamma carotenes. All of them, they are precursor of vitamin A. And they are present in plant tissue, mainly in yellow and green fruits and vegetables. More important of them is beta carotene, which consists from two molecules of retinol. If we tell about the distribution of this vitamin, you see that vitamin A active form present in the liver, kidney, fish liver, oils, milk, cream, butter, cheese, egg yolk. If we tell about beta carotenes, they are mainly, as I tell already, present in yellow and green leafy vegetables and fruits. It's a carrot, papaya, mango, amaranth, spinach, and so on. If we tell about RDA, daily recommended daily allowance, for vitamin A, it's 0.75 to 2.5 milligram per day. If we tell about provitamin, beta carotene, till 5 milligram per day. Here we have rather complex mechanism of the absorption and transportation and interconversion of one vitamin to another. See, the Absorption mainly takes place in the intestine, where beta-carotene can be oxidized cleavage by beta-carotene dioxygenase to retinol, and after it may be reduced by NADP depend, you see, by beta-carotene dehydrogenase, we cleavage beta-carotene into two molecules of retinol. After that, this retinol can be reduced with another enzyme, retinol reductase, with NADP coenzyme, to retinol. Retinol is reduced to retinol. The same in the, you see, intestinal mucosa. Retinol, the same can be transformed, can be oxidized spontaneously already to retinoic acid. Retinol and retinol, they are interconvertible. You see, they can be converted one to another. This reaction is reversible. However, retinoic acid cannot be converted back into retinol. Most of retinol is esterified with saturated fatty acid, usually with palmitate, and incorporated into chylomicrons with other fats. They form hydrophobic core of chylomicrons. And after that, they go to lymphatic system, after that bloodstream, and transported to the liver. Retinol is stored in hepatic lipocytes, as ester with long-chain fatty acid, usually with palmitate, like retinyl palmitate. When it needed, it can be released from the liver into blood circulation during the removal from this complex, retinol palmitate complex, and due to the hydrolyzation, and after that in the blood, this retinol binding with retinol binding protein, you see, with RBP, retinol binding protein. It's a protein from alpha-1 globulin fraction. Retinoic acid is transported in plasma bound to albumin. This complex, retinol RBP complex, retinol binding protein complex, binds to a specific receptor on peripheral organs, tissues for the fulfill of its function. And vitamin A has many different functions. Now let's tell about them. One of the important functions of retinol, this component of vitamin A, is a vision. Because retinol is a component of visual pigment rhodopsin. Rod cells, are required for the dim light vision. Cone cells are required for the bright light vision and for the perception of the colors. Rod cells contain in pigment rhodopsin, visual purple, and this is a conjugated protein, lipoproteins, made up of opsin and 11-cis-retinol. Rhodopsin molecules are present in large numbers in these rod cells. And when light strikes rod cells, 11-cis-retinol is converted to all trans-retinol rhodopsin. We will tell about this detail later when we will tell detail about all steps and reactions in the visual cycle. Now let's tell about another function of vitamin A. Vitamin A have, later we will tell, different mechanism of action. And when this vitamin act like steroid hormones, it directly took part in regulation of transcription of different proteins, and due to this it's necessary for the normal growth because it took part in regulation of protein synthesis. Due to the same effect, this vitamin is necessary for the normal reproduction function, and in male and in female organism. And later we will tell the same about this data. It is necessary for the normal function and, first of all, normal proliferation and differentiation of epithelial cells in lung, in gastrointestinal tract, in genitourinary tract, and it is the same necessary for the mucus secretion, this vitamin. And one more very important function of retinoids and carotenoids, first of all, retinal acids and retinoic acid and beta-carotenes, they have very important anti-cancer activity because they are antioxidant. It's the main functions of this vitamin. Let's tell about the first function of retinal in the vision cycle. As already I tell you that first of all in dark we form rhodopsin. It's a combination of lipoprotein opsin with cis-retinal. Cis-retinal, you see. After when light strikes rod cells, this 11 cis-retinal is converted into all trans-retinal rhodopsin complex. But after this isomerization, changing conformation, this trans-retinal already has no affinity to opsin and it cannot bind with opsin. That's why opsin and all trans-retinal dissociate. On moving from dim light to bright line, all rhodopsin molecules are rapidly dissociated. This reaction is accompanied by this conformational change that induced a calcium ion channel in the membrane of the rod cell. And rapid influx of calcium ions triggers a nerve impulse, allowing light to be perceived by the brain. But when the person moves back into dim light, he cannot see anything until rhodopsin is reformed. That's why necessary to reactivate this complex. For this, all trans-retinal has been isomerized again into 11 cis-retinal. And we can repeat this cycle again. See that under the action of light happens the isomerization of cis-retinal into trans-retinal, and it leads to the triggers of nerve impulse to the brain. Here we can tell about very interesting mechanism. Due to isomerization and dissociation of rhodopsin into two its component, opsin and retinal, trans-retinal, happens the activation of G protein. And as a result, how to do it back? As a result, activation of this G protein, alpha subunits of G protein activate enzyme, membrane binding enzyme, which lead to formation of cyclic GMP, cyclic messenger, which activate already this calcium channel, and such way it lead to formation of the nerve impulse. But so we can tell about this mechanism of this vitamin in vision cycle like a mechanism of second messenger. But as we tell already, necessary to reactivate this this retinal, transform it from transretinal into cisretinal, and we have two mechanisms. Main mechanism is this, because the most part of all transretinal is transported to the liver and reduced here into all transretinol under the action of liver's alcohol dehydrogenase. After that, this all transretinol is isomerized to 11 cisretinal in the liver, the same, under the action of liver's isomerase. And after that, again, it is oxidized already. This reaction is reversible, you see, and we act with the same enzyme, alcohol dehydrogenase. We oxidized it into 11 cisretinal, and after that can again form new active molecule of rhodopsin. A little part of all transretinal directly can be isomerized into 11 cisretinal in the retinal under the action of retinal isomerase in retinal epithelium. But activity of this enzyme is very low. That's why this reaction is not very intensive. Mainly, as I tell already, we do it through the liver. If we tell about another function of vitamin A, here it's already another mechanism of action. First of all, as I tell already, the action of this vitamin is necessary for the maintenance of the normal epithelial and skin formation. Because the function of retinol and retinoic acid, mainly retinoic acid, it's a very important role of them in glycoprotein synthesis, and they act like steroid hormones. This complex in the blood, you remember we tell about retinol, which binds with retinal binding protein in the blood. This complex achieves target organs. After that happens the dissociation of this complex, and only retinol is transported inside of the cell, where it binds with cellular retinoid binding proteins. And this new intracellular complex already is transported to the nucleus, where it binds with special site on DNA, hormone sensitive site in the nucleus, and binds with DNA chain. And such way it took part in regulation of transcription of different genes, and as a result to increase transcription of one gene and to stop transcription of another gene. A little later I will show a picture which illustrates this mechanism of action. And at last, one more very important function of this vitamin, as we tell already, both of them, they are and retinoids and carotenoids. They have anti-cancer activity because they are very important antioxidant. and they are necessary for the prevention of free radicals formation and prevention of hydrogen peroxidation of polyunsaturated fatty acid, first of all in phospholipids of our membrane. A little later we'll tell about another, the same very important antioxidant vitamin, vitamin E. But oppositely of vitamin E, vitamin A is active in tissues with low partial pressure of the oxygen, for example, in epithelial tissue. And one more function, due to this antioxidant effect, beta-carotenes now very widely used for the preventing of cancer and heart attack. This is mechanism of action, you see. It's not only the mechanism of second messenger, it's a mechanism like steroid hormones. When our vitamin A, first of all, it's in the blood, you see, it's bind with its carrier protein. Inside, it binds with another protein, cellular retinol binding proteins. This complex binds with DNA in a special hormone-sensitive site of DNA and regulate transcription of different genes. Some of them, they are transcribed, and others not. Some of glycoproteins, which necessary for the mucose formation, for example, or for the normal proliferation and maturation of the epithelial cells, they are produced, we activate their synthesis. And other genes, this vitamin inhibits transcription of other genes. For example, gene which code keratin synthesis. And there is no, and it leads to stop of formation of synthesis of this keratin. Remember about this, because when later we will tell about deficiency of this vitamin, the lack of this vitamin, lead to problem with the block of keratin synthesis, and deficiency lead to activation. Without vitamin A, this gene will be activated, happen the transcription, and after the translation, of this gene, and finally cell suddenly start to produce keratin, which it not need normally in this cell. Here I will tell about this, that this it's need for the formation, normal proliferation of these cells of mucous membrane and formation of the mucose. And when we tell about deficiency of this vitamin, it lead to dystrophy development of these tissues and problem with the normal formation of mucose. You see that mucous membrane are impaired. If we tell about deficiency of this vitamin, here again we have some steps, because it depends from the how prolonged time we tell about deficiency of this vitamin. The first which will answer on the deficiency of this vitamin, it's a problem with the night vision in the poor light. The name of this is night blindness or nyctalopia. Visual acuity is diminished in dim light, and patient cannot read or drive a car in poor light, and this the dark adaptation time is increased. See, if we tell about prolonged lack of vitamin A, after night blindness appear new symptoms, because happen the deteriorations of the eyes tissue through the progressive keratinization of the cornea, which results in abnormal dryness of the conjunctiva and cornea, and the lack of ability of produce of teeth, because tear ducts the same is keratinized. And this condition known as a xerophthalmia. After that, if continue, this patient has a problem with vitamin A, appear new symptoms. You see, when this xerophthalmia persists for a long time, it leads to a Xeratomalacia already, softening of the cornea. There is a degeneration of the corneal epithelium, which lead to vascularization of the cornea. After that, later already, cornea opacity is developed. Bacterial infection lead to cornea ulceration, perforation, and total blindness. It's already final result of vitamin E deficiency. In this step already, it's already on treatment. On treatment, total blindness. What else effect? This is, you see, first variant, the first symptoms of vitamin A deficiency. When in poor light, this patient can't see things in clear form. It's the earliest symptom of vitamin A deficiency. This is not blindness. But not only these symptoms appear. We know already that this vitamin necessary for the normal formation, normal function of the reproductive system. And vitamin A deficiency lead to infertility, and in male and in female organism. It lead to problem with the sperm production. It lead to fetus reabsorption, and you see, born with, if it lead finally to born, it lead to abnormal formation of this fetus. And prolonged deficiency of this vitamin lead to total problem of fertility. If we tell about skin symptoms, here we can see follicular hyperkeratosis. It's a result of hyperkeratinization of the epithelial lining of the follicles. The skin becomes rough, you see. If plus bacterial infection, it already will lead to acne. Keratinizing metaplasia of the epithelial, we can see not only this problem in the skin. The same we can see and in the lung, and in gastrointestinal tract, and in genitourinary tract, and it always coupled with the reducing in mucous secretion. And finally, epithelium is atrophied. Growth retardation usually binds not only with loss of appetite and problem with digestion due to keratinization of gastrointestinal tract. It the same can be binds with the abnormal or decreasing production of chondroitin sulfate. It the same lead to retardation. If we tell about the one more function, before this we tell about the increasing risk of cancer, if we tell about vitamin A deficiency, because first of all, deficiency of beta-carotene. It's happened due to the beta-carotene, they are very effective antioxidant. And due to this, of course, due to this effect, they reduce the risk of cancer. Because they inhibit production of free radicals. And of course, this function of beta-carotene there and vitamin A, it's a very interesting for us if we want to reduce risk of lung cancer, for example, in smokers. However, the caution needs to be taken when increasing the intake of any of lipid-soluble vitamins, because excess of fat-soluble vitamins lead to toxicity of them. And it's the same we can tell about the negative role of vitamin, of excess concentration of vitamin in the body. You see, in too much concentration, they are toxic. And if we tell about hypervitaminosis of vitamin A, we tell about toxicity of vitamin A. Here, first of all, we tell when concentration of this vitamin is so high that already all retinol binding protein binds with vitamin A and a pair unbinding retinol. And this unbinding retinol lead to a pair of all these negative effects. And liver and spleen damage, hepatosplenomegaly, and night sweats, and loss of body hair, severe throbbing headache, insomnia, restlessness, vomiting, stomach pain, lethargy, fatigue, irritability, anorexia, exophthalmos, you see here, together with specific coloration of the skin. But these symptoms appear rather rare. It's maybe or directly intake of medicine drugs with high concentration of this vitamin, capsules of vitamin A uncontrolling, or, for example, very exotic diet. If your patient eat polar bear liver because this liver of polar animals, they are very rich of vitamin A. And you see that once power of polar bear have so high dose, has a so high dose of vitamin A that can kill a person. That's why never peoples who live in polar area, they never eat livers, not meat, livers of polar animals, because it's very, very dangerous. The same dangerous hypervitaminosis during the pregnancy, because it leads to a pair of different, you see, disorders and different defects in infant. And not only visual defect, but it can be reason of mental retardation. Different cleft pair and mental retardation. That's why the same very dangerous. Next vitamin that we will discuss with you today is vitamin D. That's the theme of this vitamin D. And vitamin D, the same can be present in our food in two different forms. In plant, vitamin D2, and in animals, vitamin D3. Another name of this vitamin is calciferol. And till this time we have a discussion. What is it? Is it really vitamin or it's a prohormone? Because it's not clear vitamin according definition, because oppositely of all other vitamins, vitamin D, almost all, can be produced in our body from cholesterol, or more correctly from dehydrocholecalciferol, intermediate of cholesterol synthesis, under the action, of course, on sunlight. And that's why one more name of this vitamin is sunshine vitamin. If we tell about distribution of this vitamin in the area, it's first of all present in present in milk, in egg yolk, in saltwater fish, especially salmon, sardines, herring, but present the same in organ meat, the same in fish liver oils, very, very rich of this vitamin, and in dairy product the same. See on two precursor of this vitamin D. As I tell already, vitamin D2, ergocalciferol, it's present in the plant. If we tell about animals, vitamin D, cholecalciferol, D3 vitamins, its structure, and they differ, pay attention, only due to this methyl group, additional methyl group, and this double bond in ergocalciferol. All other parts of these vitamins are absolutely the same. Only two these differs. Pay attention here. RDA of this vitamin from 5 to 10 micrograms per day. And as I tell already, this vitamin can be produced from dehydrocholesterol, intermediate of cholesterol synthesis. But all of them, and cholesterol which we produce, and cholecalciferol which we produce from our cholesterol, or ergocalciferol, or cholecalciferol which present in animals' food. They are not active yet, and necessary two additional reactions of this vitamin activation. If we tell about our own vitamin, first of all, see what happened under the action of sunlight. What is the function of sunlight? Under the action of this, in the skin happen the breakdown of bone in the secondary ring, B ring, open of this bone, and formation of cholecalciferol. It's a vitamin D3, absolutely the same vitamin which present in our animals' food. But as I tell already, they are not active. After that, this vitamin, all of this vitamin, and cholecalciferol and ergocalciferol, they are absorbed, or they absorbed in the intestine, or they produce in the skin, and they binds with a special vitamin D binding protein. This protein is from the alpha-2 globulins fraction. And this complex already goes to the liver, where happened the first reaction of vitamin D activation, happened the hydroxylation of this 25th carbon of our vitamin. We attach OH group in the liver and form 25 hydroxycholecalciferol by liver's hydroxylase enzyme, you see. And this form, 25-hydroxycholecalciferol, it's a main storage form of this vitamin. In this structure, it is stored in our liver. When it becomes need, we take this vitamin from the liver, but it's not active yet. Necessary next final step of its activation, and this final step occurs in the kidney, where again we attach new, one more, third OH group, you see. Only now already to carbon number 1 happened the hydroxylation of first carbon, and we produce 1,25 dihydroxycholecalciferol. You see, 1,25 dihydroxycholecalciferol or calcitriol. Triol, because 3 OH group. 1, 2, 3. 3 OH group. And this calcitriol is already active vitamin D. Pay attention that this final activation takes place in the kidney under the action of kidneys 1-hydroxylase. Both of these hydroxylases in livers and kidneys hydroxylases, they are from family cytochrome P450. We took part in incorporation of one oxygen atom into substrate, monoxygenases, cytochrome P450. And this active vitamin D has one top function: regulation of plasma, calcium, and phosphorus in the blood. Of course, plasma, calcium, and phosphorus. But how this vitamin, how calcitriol regulates it? Due to the action in this position. It's a realization of function of vitamin D3. First of all, if we tell about the action of this vitamin in the, you see, intestine. Here in the intestine, vitamin D binds with the same intracellular binding protein. This complex, you see, goes to the nucleus, where it interacts with a special sensitive site on DNA, and due to this, we increase transcription of special gene, which codes a special calcium binding protein, or calbindin, and it leads to activation of production of this calcium binding protein. Due to this, a pair of this protein, we increase reabsorption, we increase absorption of calcium from the human intestine to the blood. And due to increase of absorption of calcium, we increase concentration of this calcium into the blood. It's one function. Second function in the kidney. In the kidney, this vitamin minimizing the loss of calcium in this kidney. Due to what mechanism? Calcitriol increases the reabsorption of calcium and phosphorus by renal tubules. Therefore, both minerals are conserved. If we tell about function of this vitamin in the bone, here happens the stimulating mineralization of bone when the ionic product of calcium and phosphorus increases due to the increasing activity of alkaline phosphatase. But necessary to tell about a few words about the regulation of this vitamin. But before this, I again repeat mechanism of action. You see, this vitamin, we can tell that this has this act like hormone and can produce in our body. That's why it's not really absolutely vitamin. And in many books you can read that it's a pro-hormone, because you see, it can be produced from cholesterol in the body, and this vitamin acts the same like steroid hormones, because after the binding with hormone-sensitive element on DNA, this vitamin stimulate, in this case stimulate, better to use name, regulates production of mRNA, and after that protein regulates transcription. And due to activation of transcription, activate production of calcium binding protein. But a few words about regulation of activity of this vitamin, because we can regulate it with its different mechanism. First of all, we can regulate directly. If we tell about, for example, a high concentration of phosphorus in the blood, this phosphorus directly inhibit kidneys enzymes. Oppositely, low phosphorus concentration in the blood lead to activation of cytochrome P450 in the kidney, and as a result, activation stimulation of vitamin D activation. It's such way better. If we tell about calcium concentration, here not so simply. It's indirect already regulation, because low calcium level lead to activation of parathyroid hormone synthesis, and already after this parad hormones already activate the same enzyme in the kidney, which lead to activation of vitamin D. And we have negative feedback regulation. High level of calcitriol lead to inhibition of its production. If we tell about deficiency of this vitamin, here may be different result, and it depends from the age of this patient. If we tell about deficiency of this vitamin in early age, when we tell about children and teenagers, in this case we tell about rickets. If we tell about deficiency in adult age, we tell about osteomalacia. Rickets deficiency. Rickets, when we tell about vitamin D deficiency. Here, main picture. Now let's tell about the disorders. Low lack of vitamin D lead to lack of calcium and phosphorus. In infants and childhood, it lead to abnormal bone growth and abnormal bone formation, and of course it lead to soft bones, and as a result a pair of different bone defects, as for example bow legs or knock knees, maybe swellings on the end and side of the bones, chest defects, covered spine, and together with this bone deformation, swollen skulls, you see, and together with this appear additional symptoms like muscles pain, heavy swelling, and so on. And how we will treat this patient? Of course, necessary to use a diet rich in calcium, phosphorus, vitamin D necessary to give this patient, and enough exposure to sunlight. But we can tell about different. I have many different pictures of rickets symptoms, but possible adult rickets the same. When we can tell about adult rickets? When we can tell about renal rickets in kidney diseases. Even if vitamin D is available, calcitriol is not synthesized if we tell about kidney disease, because it's happened in the kidney. In this case, we can treat this patient only with administration of calcitriol, not simply vitamin D, not cholecalciferol. Rich diet not enough for treatment. And possible one more, vitamin D resistant rickets. When we tell about defect of renal tubular for reabsorption of phosphate bicarbonate in calcium. It's, you see, different variant of the adult rickets. Simply deficiency of vitamin D in adult lead to osteomalacia, abnormal softening of the bone. There is a loss of calcium in the bone matrix, when they form already, you see, and it lead to weakness, broken bones, pain, loss of desire to eat, and weight loss after that. Why it happened? Because it lead to low concentration, deficiency of this vitamin lead to low concentration of calcium in the blood and removal of this calcium from the bone for the increasing of calcium in the blood, because calcium play other very important for our life functions. It's necessary and for the muscle contraction, it's necessary for many, many enzymes, it's necessary for blood clotting, and so on, so on, so on. How we will treat this patient? Of course, necessary to give minerals additionally, and phosphorus and calcium, the same, better to enough sunlight exposition, and add vitamin D, the same. So treatment, it's a giving of the necessary vitamins and minerals. But here the same must be very, very accurately, because high doses supplement of this vitamin, the same cause toxicity. The same we can tell about hypervitaminosis of the vitamin D. And too much vitamin D results in the poisoning that caused a loss of appetite, vomiting, diarrhea, nausea, thirst, headache, weakness, polyuria, difficulty in speaking, confusion, stupor, weight loss. But first of all, on the first place, it leads to hypercalcemia, which in turn lead to deposition of calcium in many of the soft tissues, heart, blood vessels, renal tubers, and lungs. And formation of calcium stones in them can be the reason of the death, especially if we tell about calcination of the heart and blood vessels. What is the treatment in this case? Treatment consists of stopping the vitamin doses and beginning a low calcium diet until symptoms stop. Next vitamin that we will discuss today is vitamin K. Naphthoquinone derivatives with a long isoprenoid side chain. This vitamin widely present in fruits and vegetables, cabbage, spinach, other green leafy vegetables, in cereals, in jams. And very, very important, you have to remember that it can be synthesized by intestinal microflora. This vitamin, it's a family of vitamins, naphthoquinones derivatives with a long isoprenoid site. I forgot to tell you that necessary to know the structure of all 4 fat-soluble vitamins, but for the more easy studying, you can study only the base of this vitamin and this long chain, and in vitamin K, and in vitamin A, and in vitamin E. Later I will show you. Here you can write simply R, radical. Not need to study this isoprenoid side chain. We can tell about the plant, with present in the plant food, vitamin K1, phylloquinone, or animals, menaquinone vitamin. Possible vitamin K3, it's a menadione, but it's a synthetic form. This is natural. K1 and K2, they are natural. K3 is synthetic. Daily requirement daily allowance for this vitamin, recommended daily allowance till 70 microgram per day. What is the function of this vitamin? First of all, of course, it's necessary for the normal blood clotting, but not only. But on the first place, of course, this vitamin is necessary for coagulation. The number of blood clotting factors, number 2 prothrombin, number 7 proconvertin, 9 Christmas factors, 10 Stewart power factors, they are synthesized in the liver in inactive form, like zymogens. And vitamin K took part in their activation. This is the role of vitamin K. It's necessary post-translational modification of these factors. And this vitamin necessary for carboxylation of glutamic acids residues in these factors. They are proteins, they consist from amino acid, they are rich of glutamic acid, and happen the post-synthetic or post-translational modification of this glutamic acid. To gamma carbon, we attach one more carboxylic acid, and vitamin K is a coenzyme of this enzyme. Here I already show you antivitamins, dicumarol and warfarin, because they act like inhibitor of this reductase enzyme we took part in reactivation of vitamin K. But the using of this enzyme in medicine, about the using of them, we will tell later. Dicumarol and warfarin, they are antivitamins. That's why vitamin K necessary for coagulation. Antivitamins, they are anticoagulant agents. You see, and here the place of their action. It's our proteins, factors. They have glutamate, glutamic acid. Under the action of vitamin K, we attach one more carboxylic group, happen the carboxylation of gamma carbon, and on this picture I take it from the book, but here present a mistake, sorry. Here necessary to write CH, of course, not CH2. And to this gamma carbon, you see here already 2 carboxylic group. It's very important because in neutral pH, both of these carboxylic group, they are dissociate, they become ionic, you see, and a pair here, not 1, but 2 negative charge. And happen the ionization of them. And to this negative charge of these 2 carboxylic group act as a calcium binding site, because calcium has 2 pluses. See, they binds calcium to this negative charge, and we can tell that it's the main function of vitamin K, to create calcium binding site on prothrombin. As a result of this, prothrombin after that becomes biological active, and this active prothrombin can form calcium binding, calcium complex bridges to the phospholipids of platelets membrane, and it's a start of blood coagulation. Similar sites are probably created by vitamin K on factors on 7, 9, and 10 factors also. That's why deficiency of this vitamin lead to problem with blood coagulation and as a result hemophilia. But vitamin K is also required for gamma-carboxyglutamate in osteocalcin. It's a calcium binding protein which present in the bone. That's why deficiency of this vitamin lead to problem of mineralization of the bone and defect of bone. As a result, appear scoliosis, hypermobility of joints, And problem with the skin, the same appear because it's necessary. This vitamin is the same necessary for activation of osteocalcin. Hypervitaminosis of K, toxicity of vitamin K. Well, in usually life it's almost impossible, but you know that now very widely we use in medicine K3, menadione, synthetic analog. And if we happen the administration of very large doses of this vitamin K, it can lead to hypervitaminosis with this, you see, negative result. It can lead to massive thrombosis, very harmful, of course. After that, hemolysis, due to toxic effect of this vitamin, and result of hemolysis of erythrocytes, it lead to hyperbilirubinemia, jaundice, and brain damage. The same can, especially in early age. So it lead to hemolysis and thrombosis. Why? I want to pay attention one more time that in medicine we use usually not vitamin K, but it's, you see, synthetic analog, menadione, or Vicasol, derivative of this vitamin, because this synthetic analog, it's a water soluble, and we can inject it immediately into the blood for the stop of the bleeding, acute bleeding. Next vitamin which we will discuss, the final vitamin from fat soluble, it's a vitamin E or tocopherol. It's the same family of different vitamins. We can tell about A, alpha, beta, gamma, tocopherols, but the most activity has this tocopherols that we will discuss with you today. And this vitamin has many different functions, but on the first place, it's the strongest, most powerful natural antioxidants. I will show you the structure of only the tocopherol with the highest activity. It's an alpha tocopherol, but first of all, let's tell about the sources of this vitamin. Very rich of this vitamin, all oils, but it's the same present in some fruits, for example, in cabbage, in broccoli, in green leafy vegetables, but present in nuts and in seeds. The same may be present this. Here, the strongest from tocopherol family is alpha tocopherol. And again, I want to tell you that you can, first of all, study these structures, and this long chain you can write like radicals. All tocopherols, they are absorbed together with other lipids, and after that they are transported in chylomicrons from the intestine to the liver. From the liver, it's transported inside of another lipoproteins, very low density lipoproteins, to the adipose tissue, and the main store for it's stored mainly in adipose tissue, but in muscles the same possible. One of the function of this vitamin, it is necessary for fertility, for spermatogenesis in males, and for the normal fertilization in the female organism the same. From here the name, tocopherol. But this vitamin the same play another function. It is necessary for the muscle development the same. But on the first place, of course, antioxidant function of this vitamin. Here you see recommended daily allowance of this vitamin. You see rather high amount necessary, 10 milligram per day of this vitamin. You see function of this vitamin. First of all, biological antioxidant. You know that free radicals are continuously being generated in the living system, and they attack biomembrane and lead to damage of different biomembrane. First of all, erythrocytes, and their prompt inactivation is very important for us. And vitamin E inhibits oxidative destruction of tissues components and prevent the non-enzymatic oxidation of cellular and subcellular membrane compounds. First of all, polyunsaturated fatty acids. By the decreasing of free radicals formation from oxygen, and first of all in tissues with high oxygen concentration, in erythrocytes membrane, in membrane of respiratory tree, in nerve cells, in retina. If you remember, we tell that in tissues with low oxygen concentration, more effective vitamin A. And such way, deficiency of this vitamin lead to increased sensitivity of erythrocytes to peroxide action, and as a result, the damage of these erythrocytes, and as a result, hemolysis of erythrocytes. And one more, so all these two functions directly bind with antioxidant function of vitamin E. And one more function, it's necessary for the normal reproductive function and prevent sterility. Even we use this vitamin, we give this vitamin chicken for increased production of eggs, for example, the using of this vitamin in our life. Not only for us, for all animals. I will tell about the deficiency of this vitamin. First of all, the lack of this vitamin lead to muscle damage and blood disorders, anemia due to hemolysis of erythrocytes. But after that, it lead to liver kidney damage and infertility. We tell about this. And the manifestation of all these symptoms binds with the age. With increasing of the age, happens the progressive increasing of the damage of different organs and tissues. Deficiency can bind not only with, as usually, with low concentration of this vitamin in the food, but as all other fat-soluble vitamin, deficiency can be reason of the abnormal absorption, abnormal transportation. For example, here the same, the lack of a special tocopherol transport protein can lead to deficiency of this vitamin. This protein necessary for the normal absorption of this vitamin. Even we don't tell about the toxic effect of this vitamin because till this time unknown. Even very high doses of this vitamin usually doesn't lead to any problem in our body. Only sometimes we have some discussions that very high dose of this vitamin may be lead to may be harmful for patient with high blood pressure, but without explaining. Some works describe this vitamin in high concentration has a cancer effect, cancerogenic effect. but the same. You see, it's simply discussion. Mainly we tell that even high doses of this vitamin is unharmful. But pay attention that this vitamin is destroyed by cooking and food processing, including deep freezing, that when necessary, prepare food. Better to use this vitamin simply with vegetables, oils, without cooking. One more question that we will discuss today, antivitamins. Name already show us that this class of compounds counteract the main effect of vitamins. And this term already of antivitamins show their effect. It's a class of absolutely different substances with absolutely different action, but result of their action is decreasing of vitamin activity and vitamins effect. And of course, antivitamins can lead to hypo or even avitaminosis. Classification of these compounds, classification of vitamins, depend from the mechanism of their action, and usually we divide them in three classes. First class is antivitamins, which are structurally similar to vitamins. These antivitamins act as a competitive inhibitor, competitive antagonists. When they interact with apoenzymes, they form inactive enzyme complex and with all reducing of adverse effects. Example, it's maybe you see warfarin and dicumarol, they are antagonists of fat-soluble vitamin K. And they act inactive complex with vitamin K reductase. Second class of antivitamins, it's antivitamins which alter the chemical nature of natural vitamins. They're absolutely different. They have different functions, but one of their functions is destroy of vitamins. Usually they are enzymes. For example, famous thiaminases, thiaminase 1, thiaminase 2, they break down thiamine and in such way to stop its activity. Or for example, ascorbate oxidases, which catalyzes the decomposition of vitamin C, you see? And the last third classes, here antivitamins which binds the vitamin molecules and inhibits or their absorption or transportation, or they form stable inactive complex with them. For example, protein avidin, which present in the egg white, and these glycoproteins, they can bind with biotin and enter biologically inactive complex, and such way prevent the action of biotin, and as a result it lead to a pair of symptoms of this vitamin deficiency. Some of antivitamins are used in medicine to correct different biochemical and physiological processes, and it is necessary now to study more intensively the possibility of using of antivitamins in medicine, because till this time mainly we use only antagonists of vitamin B9 and vitamin K. We already discussed it. Dicumarol, warfarin, tromexan, antagonist of fat-soluble vitamin K, we widely use in medicine like anticoagulants agents. In the treatment of some malignant tumors, leukemias, for example, we use antivitamins for folic acid, vitamin B9, for inhibition of biosynthesis of purines, and such way by stop production of nucleic acid, which prevent uncontrolling cell division. And there are aminopterin, ametopterin, monoone like methotrexate. You see, these antivitamins very widely be used for treatment of leukosis. Here you can see on this picture the name of populist antivitamins for different vitamins. Here I tell already that it's antivitamins for vitamin K, which widely be used for treatment of massive thrombosis, for example, because they are anticoagulants. And this is ametopterin and ametopterin, methotrexate, antivitamins for folic acid. You see, they have similar structures, and they inhibit purine synthesis and inhibit such way cell division in the uncontrolling cell division when we tell about cancer tumors. That's all about vitamins. You see, we finished so difficult topic, and now we have time yet. It's a very good, even 25 minutes. That's why we start to tell about one more very important and interesting, I hope, topic. We will start to tell about hormones. Hormones, the same organic molecules, the same act in very small amount. The same, they are necessary only for regulation of our metabolism, and they are never used for plastic processes or for energy production in our body. You see, we start tell about them like as about vitamins. Only oppositely of vitamins, hormones are produced in our body. It's a difference from them. That's why hormones are chemical substances synthesized in a small amount by endocrine tissues or cells with endocrine function, and they carried in the blood to another tissues, target organs, for the regulation of function and metabolism in these organs. This word hormones is derived from the Greek verb hormon, meaning to stir up or excite. You see that for the normalization of our metabolism, for the changing of our metabolism according to our needing, according the changing of environments, necessary to regulate different processes and functions in our tissues and organs. And coordination of the body's device metabolic activity is achieved by hormonal and neuronal signaling. Individual cells in one tissue sense a change in the organism's circumstances and responds by the secreting an extracellular chemical messenger. If we tell about endocrine cells, they secrete hormones. Neurons secretes neurotransmitters. In both cases, this messenger, extracellular messenger, pass to another cells, target cells, where they bind to a specific receptors molecules on surface or inside, and triggers the change in the activity of the second cell. Some of the chemical messengers are common for both systems. For example, epinephrine and norepinephrine. They serve as neurotransmitters in the certain synapses in the brain and smooth muscles, but this epinephrine and norepinephrine, they also as a hormones regulating fuel metabolism in the liver and the muscles. You see, they are together, and neurotransmitters and hormones. In the clear endocrine system, hormones are secreted by the producing cells into the bloodstream, which carry them throughout the body to target different target organ or tissues. And these target organs may be more than a meter away from the secreting cells. And the final link in the system is that hormones interact with a specific receptor on or in the target cells, triggering answer responses. You see? So we have a place of the endocrine secretion and target cells which is rather far from the place of secretion. After that, these hormones interact with or receptor on surface or inside, and only if we have a special receptor for hormones, only these organs or cells, they are target cells and can answer on the action of this hormone. If this cell has no receptor, if the cell have no receptor, it is not target cell and doesn't answer on the influence of this hormone. Now, this picture more for repeating of different action of signaling agent. If this chemical signaling, they are produced and act inside of one cell, we tell about this mechanism intracrine. If they are secrete out of this cell and interact with the surface of the cell, we tell about outercrine mechanism of action. If some of them, they act nearby of their production on neighbor cells without releasing in the bloodstream, we tell about paracrine action. If they act through the transportation with the bloodstream, we tell about clear, you see, endocrine action. And here, the same, we tell about secretion from the neurons, about neuroendocrine action. And we tell that epinephrine and norepinephrine, they have both variant of action, but this variant, the same possible. For example, insulin act like endocrine hormones and promotes its effect, or insulin the same, which is produced in the beta cells of pancreas, can regulate production of glucagon in alpha cells and achieve this effect due to paracrine mechanism of action. So maybe combination of this mechanism of action. If we tell about the general functions of hormones, of course, general functions, it's regulation of our metabolism. But inside of these general words, we can tell that hormones are necessary for the homeostasis, keep of homeostasis constant of our body. They are necessary for the reproduction. They are necessary for the growth and development of organism, maintenance of internal environment, production, utilization, and storage of energy. And for the correct action of hormones, necessary as minimum cell or organs of their cells or organs of their synthesis, target organs, and the number of regulatory feedback loops for the regulation of production and activity of these hormones. So if we tell about hormones regulation, always for the normal function of them, necessary treat this component, cells of their synthesis and secretion, target organs, and regulatory loops. If we tell about hormones function, they act in a complex hierarchy. And it's very important because remember that they act in hierarchy, because some of them they are produced at the top of hormones, and their function is only regulation of next level of hormone synthesis. Second, hormones, the same, can or act directly on target organ or regulate production of hormones in peripheral endocrine action. And this hierarchy of hormones is the base of one of hormones classification, because we have the number of hormones. We can classify them according to their solubility, according to their chemical structure, according to their function. About function we tell you above, and one of classification according to the hierarchy of their system. The top of all hormones are hypothalamus. Hypothalamus, it's a specialized portion of the brain, functions at the top of this hierarchy system, as I tell already, and some hormones are produced here. And we tell that this is a coordination center of the endocrine system. It receives the neural input from different regions of the brain, and it receives the feedback signals from the hormones circulation in the blood. All these signals are integrated in the hypothalamus and we lead to answer by the releasing of a special hypothalamic hormones. And these hormones, hypothalamic hormones, regulate production of hormones in the pituitary, next in this cascade. Pituitary hormones can or directly act on different tissues and organs, you see, or regulate production of hormones in peripheral endocrine gland. These hormones and all other hormones, they act in very small amount. Part of these hormones, they activate production of hormones in anterior pituitary, and we tell about them like releasing hormones. Part of them, they are statins or inhibiting hormones. You see, it's one of classification of hormones according hierarchy of their production and action. One more classification of hormones according their chemical structure. We classify them in peptide hormones, amino hormones, steroid hormones, and eicosanoids. Only these peptide hormones, the same we can divide in some groups, these first peptide hormones. It may be or peptide hormones like here, which may have from 3 to above 200 amino acid residues. For example, all hormones of hypothalamus and pituitary and pancreatic hormones, the glucagon, they are peptide hormones. It may be simple protein, which consists more than 200 amino acids, but primary, more amino acids, more longer amino acids. But they have no non-protein part, they are simple. For example, prolactin, somatostatin, and complex protein, which have non-protein part. No, traditionally they are glycoproteins. Usually they have polysaccharides, usually branched polysaccharide. For example, gonadotropins. Amines, now let's tell about this group, amines hormones. They are compounds derived from the amino acid tyrosine and include water-soluble epinephrine and norepinephrine and less water-soluble thyroid hormones T3 and T4. for. If we tell about steroid hormones, they are fat soluble and they are derivative of cholesterol and includes adrenal cortical hormones and sex hormones. If you tell about one more groups, you see eicosanoids. They are not clear hormones, endocrine hormones, because they act locally. They have paracrine mechanism of action. But let's tell about them a few words. They are derivatives of arachidonic acid, arachidonate. You know, it's a polyunsaturated 20 carbons fatty acid, consists 4 double bonds, and in this class, in eicosanoids, we can see 3 main groups: prostaglandins, leukotrienes, and thromboxanes, and they have special function. And if you remember, we tell about them last semester when we tell about lipids, because it's a class of lipids. Here the scheme of all this classification, you see it's maybe or proteins, peptide consists from amino acid, or derivative of cholesterol, steroid hormones, or amines hormones, which are produced from tyrosine, or you see eicosanoids, derivative of arachidonic acid. If we tell about peptide protein hormones, and we start from them today, they are hydrophilic, first of all. They are large, more bigger than amines or steroid hormones. They are soluble in water. They have mechanism of action, mechanism of second messenger. An example of them, for example, the famous insulin. And they act they interact with receptor on surface of cellular membrane. If we tell about steroids hormone, they're smaller, of course, because you see they are only cholesterol. It's not cholesterol derivative. It's hydrophobic, but lipophilic. For their transportation necessary a special carrier transport protein, of course, because they are hydrophobic, and they have mechanism of action due to regulation of transcription, because they interact with cytoplasmic and nuclear receptor inside of the cell. And the example, estradiol, progesterone, and so on. Mineralocorticoids. As I promised, we start from peptide hormones. First of all, we already tell about the central regulatory role of hypothalamus in our body. And really, hypothalamus interact and it's join together all signals from other part of brain and from feedback loops coordination. It's integrate, as I tell already, all this information, and after that use it for regulation of all hormones production due to regulation of pituitary hormone synthesis. Pituitary gland usually often is, we tell about the pituitary gland as a master gland of the body, because here we produce hormones which took part in regulation of all our metabolism, and it secretes a battery of hormones, and these hormones collectively influence on all cells of our organism, and they have effect on all physiological processes. But if pituitary gland may be king, but the power behind the throne is clearly the hypothalamus, because hypothalamus regulates pituitary and production of hormones in pituitary. If we tell about hypothalamic hormones, we can see only two groups of them. One of these hormones activate production of hormones in pituitary. That's why we tell that they are liberins or releasing factors. And we know 6 different releasing hormones. Corticotropin releasing factors, or corticoliberin, another name of this, thyreotropin releasing hormone, or thyreoliberin, gonadoliberin, growth hormone releasing factors, or somatoliberin, prolactin releasing factor, prolactoliberin, melanotropin releasing factors. And only 2 statins, or inhibiting hormones, inhibiting factor, they are inhibits production of hormones in posterior pituitary. The hypothalamic releasing hormone, you see, they or increase, if we tell about releasing hormones, or inhibits production of hormones in anterior pituitary. Pituitary hormones. It's a special part of our brain, and usually we divide pituitary in 3 lobes: anterior pituitary, interior lobe, intermediate lobe, and posterior pituitary, and different hormones are produced in these different lobes of pituitary. In anterior pituitary, you see, you produce growth hormone, thyroid stimulating hormone, TSH, adrenocorticotropic hormones, ACTH, prolactin, gonadotropins. If we tell about intermediate lobe, melanocyte stimulating hormones, and in posterior pituitary hormones, 2 hormones are produced: vasopressin, or ADH, antidiuretic hormone, and oxytocin. If we tell about these hormones, I already tell you that they have different effects. One of them, they took part in regulation of hormone production in peripheral glands, endocrine glands. Another, they act directly on target organs already and regulate physiological and metabolic processes in this target organ. Let's start to tell about each of these hormones, and we start from famous growth hormone. Just now I will see how many times. I have no times already. It's very, very pity. But you see, next time we start from this position, from growth hormone, because this hormone plays very important and interesting role in our body with many different effects, and deficiency of this hormone lead to the dwarfism or acromegaly. But now we will stop, and please remember that we stop our lecture on this place: growth hormone. That's all for today. Goodbye, dear students. I hope to see you next week on the same time, and we continue to tell with you about biochemistry of endocrine system. Goodbye.